Welcome back, beautiful tri-state area. You're listening to A Moment of Zen right here on 710 WOR, the voice of New York iHeartRadio. I'm your host, Zen Sams. Up next in our Going Deep segment, we're featuring Dr. Calobrace, an internationally recognized leader in aesthetic breast surgery. He began the Beauty Through Science New York conference in 2022, bringing together the world's greatest educators in surgical and non-surgical aesthetic medicine, setting a new standard in education. He co-chairs the aesthetic training program and breast emergency response work group committees. Today, he's joined by Dr. Kamakshi Zeidler, board-certified plastic surgeon, founder of Aesthetx, the premier plastic surgery and dermatology practice in Silicon Valley. A leading authority and principal investigator for clinical trials, Dr. Z collaborates with companies to bring new techniques and technologies and innovative products to the field. She has authored many publications on novel technologies, procedures, and safety for aesthetic and reconstructive breast surgery, and her publication. Now, breast augmentation remains the most common surgical procedure for women. By contrast, surgery to remove implants increased by over 25%. That's an overall 50% increase in the last 4 years. Breast lifts increased by 33% in the last year alone, making fat grafting a very, very popular technique. Now, fat grafting is gaining ground as a minimally invasive breast reconstruction option. Plastic surgeons can reconstruct the breast with a fairly new technique called fat grafting, or fat injections, what they call. And a surgeon uses liposuction to take fat tissue from your thighs, your abdomen, or your buttocks and transfers the fat to your breast to reconstruct it. Now, this type of fat grafting breast reconstruction is also called autologous fat transfer and is usually performed under general anesthesia. Surgeons can also use fat injections to make minor aesthetic changes to a breast shape, balance, position, and especially after breast reconstruction surgery, this matters a great deal. This type of fat grafting is sometimes called lipofilling and has been around for much longer. Don't take my word for it. The experts at hand are joining us right now. They join me to chat plastic surgery, breast reconstruction, latest techniques, and trends. Joining me now are my superstars at hand, Dr. Calobrace and Dr. Z. Welcome to the show, my friends.
Hey, thank you.
Thank you. So great to be here.
Yes, and Dr. Zeidler, KZ as I call her, has been my friend for a very long time and a collaborator on many things, many meetings, and many publications. So we know each other very, very well.
I love it. You're like the dream team. It's like Mr. and Mrs. Smith. Boom, let's go.
We do find ourselves different places around the world often. Yes, we do.
Yes.
Well, you're
looking just as fabulous, of course.
Well, of course. So, Dr. Z, let's start with you. What are some emerging trends or technologies in breast surgery that you're currently seeing?
You touched on a lot of them. I think I look at it as the fashion movement in a way that we see, like, smaller breast sizes are becoming more popular, a chicer look. And I think with that, the option to choose aesthetic breast surgery that doesn't involve implants is definitely increasing. So you talked about fat transfer. This is something I've done for the past decade. It's the technologies that are making it more predictable are improving. And then I would say the adjunctive treatments to really enhance the overall results so that people can confidently feel comfortable about how beautiful their breast can look without the need for some of the long-term maintenance that implants require.
And I particularly love fat grafting because they include some of the more incredible advantages, like your body can't reject the transferred fat since it's your own tissue. And, we're seeing a lot of complications with breast implant illness arise and BII. Dr. Calabrese, talk to me. What are some of the emerging trends or technologies that you're advocating for?
Well, I think you're right on the right line of thought about this, because I call it implant hesitancy. There's a real implant hesitancy in our community and around the world. And so we find options that are other than that. So I published a very large article on breast lifting about 10 years ago. And 80% of my patients at that time, when they got a breast lift, got a breast implant. Now, probably only 40% of my patients who get a breast lift get implant. We do other things. We do breast lifts. We do what's called auto augmentation, taking their own tissue and moving it up, making it look like an implant. And of course, what you've talked about, fat grafting, which has just exploded both in breast reconstruction, aesthetic breast, but also in body contouring and in facial aesthetic surgery too. So fat grafting is where it's at right now.
And fat grafting, I have a quick question that it was not part of my original commentary here, but what if you don't have any fat to give? Or will you always find, even on the thinnest of patients?
Well,
That's a tough one.
guess who needs fat sometimes are those patients who don't really have much fat. They're very, very thin, and thus you really need fat and you can't hardly find it. It's surprising how often you can find some fat to help you out. But to do a complete reconstruction with just fat grafting, you would need a large volume of that from patients. And, so often we have that. If not, then you may choose to do a small implant and use some fat grafting, just a little bit you get to soften it. And so you don't have to use such a big implant. So we call that a composite breast augmentation, where we include a small implant and then also fat grafting.
Got it. Now, okay, so as surgeons, you're both surgeons here and you're amazing at what you do. Healing is extremely important. What techniques or products are you using to speed healing? I mean, what do you think about this new trend, carbon dioxide as an ingredient?
Yeah, I think this is actually fabulous. I mean, I think there's two components. One is prepping the skin and getting ready for recovery. So there's topicals. Elastin has a great family of things that enhance the healing process, decrease bruising, decrease edema. But I think when it comes to fat grafting in particular, you want every one of those fat cells to survive the fat transfer process. And fat cells are very sensitive. So anything that can nourish them through those first couple of days while they're getting their blood supply is important. And I think, we've both jumped on this CO2 lift, the carbon dioxide topical therapy. I mean, I think historically injections have shown that it increases oxygen to the tissue. So it's a cool little thing in science that carbon dioxide bumps oxygen off the hemoglobin. So right at that level, you're getting an intense dose of oxygen as well as increased blood flow. So when patients have fat transfer to the face, particularly like patients fat transfer to the breast, or especially someone who's really thin, like we were talking about, and we're getting little bits of fat from all over the body. We want every drop to survive. And so applying this mask immediately after surgery and having patients do it the day after, the second, third day, during that critical phase of cells surviving, I think that we're seeing that this really enhances the overall take of fat and the quality of the results.
Yeah, and I do think that, like KZ said, we are also developing systems that we can use to process the fat that actually help to retain better. Classically, patients were told about half of your fat will go away. And today, by the way we procure, process, and place the fat, we actually can get that number up to more like 80% for that. And I'm doing a clinical trial, a multi-site clinical trial. That's a 1-year trial to really look at retention of fat over time. And so there's a few systems like that. So I think that's also important too. How we handle the fat, what we do in the operating room, how we place the fat to get the best survival is really important.
That's very important. And back to what KZ was just saying, when you look at a non-invasive product like CO2, it immediately diffuses at the cutaneous and muscular microcirculatory levels, resulting in higher tissue oxygenation, to her point, and neoangiogenesis. And the blood vessels, without a doubt, will widen. This is just science, increasing the transport of oxygen body tissues for cellular regeneration and anti-inflammatory effects. I have personally tried this procedure, carbon dioxide therapy. It has many proprietary uses, whether it's on the face or vaginal rejuvenation or the penile rejuvenation. But yes, I mean, this is all, it comes down to science. Now, Dr. C, using fat for surgery is more, like we've been saying, more popular now than ever these days. But what are some of the more common risks involved, and what do you rely on or use to mitigate and alleviate some of the downfalls?
Yeah, I was just talking to a couple of patients yesterday, and I said the biggest risk really is that, you don't have enough of a result. I mean, that's the biggest downside. And so having clear expectations. But I think outside of that, the risk of getting a cyst or like a little lump, what we call fat necrosis, where some of the fat cells didn't survive. So they shrivel up and die and either liquefy or form a little scar ball. And having these things can be concerning. We've talked about breast cancer, and it's not that it increases the risk of breast cancer, but if you find a spot in your breast, it leads to a lot of concern. And now you need a mammogram, need an ultrasound, and do you need a biopsy? Thankfully, these are very, very rare. And like Dr. Calabrace was talking about, processing the fat, doing a gentle liposuction, cleaning the fat, doing a very careful injection technique where it's like planting seeds. So little drops of cells are spread into the tissue like a sponge filling up with water. This really decreases the risk of any problems. And so we see very few of them. And then even research has shown, compared to a breast reduction or a breast lift, the changes that you see on a mammogram are much less with fat grafting than you would see with a breast reduction or a breast lift. So in general, the changes you see in the breast are minimal. So I think those risks are minimal. And the final thing is that you cannot forget about the rest of the body. I mean, of course, you can liposuction everything and get fat, but are you making the rest of the body more beautiful and making sure that you're not damaged? So you really need to think about how the fat is removed in such a way that you're enhancing the body and not sacrificing the rest of the body just to create beautiful breasts.
Dr. Calabrace, I know that you touched on this a little bit earlier, but the way we learn how to prevent, diagnose, and treat illness is via clinical research. Many different elements of scientific investigation are involved. Of course, it involves human participants and helps translate basic research done in labs into new treatments and information to benefit the patients. But what is your expectation as a provider on clinical research and peer-to-peer education? And how important are journals, medical research, and studies to you?
Well, they're everything. They're everything to me.
Everything.
A person who's published textbooks and articles galore over the years, and published many of the FDA trials. There's a lot of opinions, but in that makes it managing anecdotally medicine is an impossible task, because you're going to take every social trend and try to follow it and learn from your patients. But the truth is, your patients depend upon you to try to decipher what is a thought or a belief from what's actually true. But often as a clinician, we don't even know the truth. We're not sure yet. The only way we can get to that truth is through clinical trials that have controls, so we can actually understand what we're looking at and get some results. They are vital. And I hope patients, even in light, you mentioned breast implant illness, in light of things such as that, where we don't know enough yet, right? There's a lot of opinions that fill in the space, but those opinions aren't actually necessarily true, or maybe they are completely true. But until we have good science and good research, we are not going to know. And then me and KZ are left managing patients in the midst of it before we have good science. So all we can do is do the best we can do during that time, plus continue to work to provide the science so we have better answers.
Knowledge is power. And I absolutely love that as surgeons and as taking pride of the information that you are using to then in turn give the best service to your patients and really impact lives, that you are putting in the time and effort and doing the research and putting your expertise down on paper anecdotally, which is so extremely important. That's one of the reasons why I would choose as a woman to come to your practice, because you are so well versed and educated, the two of you, on these, on the forefront and at the forefront of education. Now, we have 2 minutes left, and the first question to KZ, Dr. Z. How important is skin health before you operate? And then I have Dr. Calabrace as the last question. I want to talk about beauty through science. So Dr. Z, you go first.
Yeah, skin health. Well, I'm actually a super huge fan of skin health, and having a dermatologist partner in my practice really helped me come to this full circle understanding. And so when patients come to me, whether it's a minor procedure, just looking at improving their skin, it's something non-invasive like toxins and fillers, or a major surgery like facelift, the skin is the canvas. It's your first impression. And not only does great skin enhance the results, but it also prepping the skin so that it's really healthy to recover well from any invasive treatment is really meaningful. And so with that, just like Dr. Calabrace was talking about, the science is important. There's so much skincare out there, right? How do we know something is really going to make a difference? And so having the research to show that it really does gives me a lot of confidence in recommending products that we do.
Research, research, research. It's all about the research. Okay, so Dr. Calabrace, tell the audience about beauty through science. What is it? How did you, what was the inspiration behind this? How did the beautiful Dr. Z get involved? And what is the role of a key opinion, so to speak? What inspired the name Beauty Through Science?
Well, Beauty Through Science is the idea we've just been talking about, that, we're going to direct our treatment of beauty, not doing it anecdotally, but through science. And let's get the science. And so bringing surgeons together and bringing dermatologists together and bringing all the specialties together to have a joint meeting. It was the inception of an idea of Per Hedén out of Stockholm, Sweden, many years ago, probably 20 years ago. And then I became faculty, then KZ became faculty. And then I brought that with Per to the United States, and it's a New York meeting. It's December 1st through 3rd this year. It's dermatologists, nurse practitioners, PAs, plastic surgeons, everybody, for 2 tracks of education. And it's trying to bring the best educators in the world, the best scientists in the world, who can bring science and knowledge, especially like fat grafting. It's going to be all over our program, talking about it and really giving best techniques, best ways to manage fat, etc. So we invite everybody to come to bts-newyork.com, and you can sign up and register for a great meeting. We're right there in New York with all the dermatologists and plastic surgeons. It's a big miss not to come and hear what's said. It's very easy for everybody in the New York region.
I will be there, and you have made me a huge fan, not only of your practice, but of listening to both of you speak. And I thank you for coming on. We are officially out of time, my dear friends, but you guys are incredible. Thank you for being my experts today.
Thank you.
Thank you.
Guys, that was our Going Deep segment, brought to you by CO2 Lift. You definitely have to check out the incredible Dr. Calabrace. You can go to calospa.com and do check out the fabulous Dr. Zeidler at aesthetxtx.com, or you can check her out directly on the gram at aesthetxmd or Dr. Zeidler. You're listening to A Moment of Zen right here on 710 WOR, the voice of New York, iHeartRadio. We'll be right back after this.
A Moment of Zen is brought to you by CO2 Lift. As we age, our skin loses moisture and elasticity, causing wrinkled skin. You can reverse this aging process with CO2 Lift. CO2 Lift utilizes the powerful benefits of carbon dioxide to lift, tighten, and regenerate your skin. This simple, painless at-home Carboxy therapy treatment is scientifically proven to reverse the aging process. You will see reduction in wrinkles, increase luminosity, and improve pigmentation, sagging, skin tone, and radiance. For more information or to order CO2 Lift, go to co2lift.com.